Hello, my name is Jill Savannah, and today I will be doing discussion board number 13 about health and well being. We watched a TED Talk by David R. Williams about how racism makes us sick. And I will say, two of the most interesting facts discussed during this was he talked about in the early 1990s he was asked to review a new book about health on Black Americans, and in nearly every chapter, the book had 25 chapters. In nearly every chapter, the book stated that racism was a major factor negatively affecting Black health, but it did not provide any strong evidence or support as to why those claims are. But it was a fact. And the speaker said that knowing this, it bothered him because he was like, why are we evidently seeing why are we seeing that racism is a problem but we're not understanding where it's coming from? There's obviously evidence there that proves that racism is affecting the health and well-being of the Black community, but no one is really understanding how. Another thing that kind of spoke my interest is when he said after that, a few months later, the speaker began to try to conduct research on how racism impacts more health more directly. And during this time, he went to an event and a student argued that racism was important, and it was a white student. He argued that racism was important, but it was difficult to measure scientifically, and the speaker disagreed and committed himself to finding ways to opportunize and study racism more systematically. And he says that because if we can measure self-esteem, if we can measure different functions of our personality, we can measure racism. And also, this is kind of important to me because this also takes place in the 1990s, and seeing how, although this is almost 30 years ago, conversations like that were being held. Um, and racism has affected the Black community since we've been here, and since we were taken from Africa to the States. This has always been an issue, and so it doesn't. It's interesting to know that the understanding of how it's affecting us more than just on the surface level and health wise in the 90s was very surprising to me. But when he was researching how the evidence behind how racism affects health, he described three ways to measure discrimination. And the first is direct discrimination. And this is such as a unfair treatment based on race every day or discriminated. And this is just when you're getting pulled over by cops, this raises your stress levels, or when you're just wrongfully discriminated based off of your race. This is something you have to live with daily. And then the second is poor treatment in everyday interactions, including like with people in healthcare settings. You can tell a healthcare provider as a Black woman you are in so much an intense pain, and they won't take you as seriously as the white woman that comes in and says she's in that same amount of pain. That also affects your well-being. And the third is more subtle and systematic, but capturing the daily stripping away of our dignity and respect that society often affords others. So knowing that we lack respect because we're Black, but there are people that get respect. Same people, same everyday functions. We all do the same thing, but we lack respect because of our skin color. Um, this chronic stress and chronic stress and loss of dignity can accumulate over time and contribute to negative health outcomes such as increased blood pressure and other stress related ideas. He was also talking about breast cancer and all these things. And I think a solution or strategies or intervention that can possibly impact the health of African Americans as well is creating environments as where we're not always so stressed and less stress-based environments. I feel as though it's easy as a minority to constantly feel stressed because we are often not in the same tax bracket as people, and we have these setbacks. But I think a good thing is to prioritize our mental health. Therapy is important. Going to therapy and trying to incorporate therapy in people's everyday life is really important to that. And then also just another intervention I think that also we need to see increasing is culturally competent care. And this is where healthcare providers are trained to understand and respect patients' cultural backgrounds and communication styles and their lived experience. And when we do this, we provide better environments for our patients and for us, and we're understand within the health room, and our health is taken as a serious matter. So these are just different ways we can look about it. But yes, this is my discussion board on health and well-being.